Good evening, everybody, and welcome to episode 3 of RaoHospital's pregnancy web series, in trimester of pregnancy. Last 2 weekends, we've done preconception and we've done the first trimester. We've been doing this every Saturday at 4 p.m. So do drop in any questions that you have and we're happy to answer them. So today we're going to be talking about the second trimester of pregnancy where, your pregnancy is kind of well by now. And your appetite, or even a preterm birth. So we just want to educate you about the various things that can happen during the second trimester and also the do's and don'ts during the second trimester. Today we have Dr. Suganya, who is our expert, and she's an ObGyn with a keen interest in fertility and obstetrics. So she will be taking you through the second trimester of pregnancy in detail. On to you, Dr. Suganya.
Thank you, sir. I'm Dr. Suganya, and I'll be talking to you about the second trimester of pregnancy. So what is the second trimester of pregnancy? It is the months 4 through to 7, but that's between 13 to 28 weeks of pregnancy. And I would call it the honeymoon period of pregnancy because this is a time when your body starts to get accommodated with the pregnancy, your energy levels rise up, you'll be able to see the baby bump, and the difficulties that you had during the first 3 months of pregnancy ease out gradually during this period of pregnancy. So if you've not told your relatives regarding this pregnancy, this would be a nice time to announce the arrival of the newborn soon. Now coming to the changes in the mother and the baby. So what's happening exactly to the baby at this point of time is that now the baby starts kicking, the baby starts moving, the baby is able to close and open the eyelids, the baby's brain starts growing, and the baby is also able to listen to the sounds, external sounds. And now placenta, which is an organ that helps in the transfer of nutrients between the mother and the baby, is also well developed at this time. So this is a great time to start bonding with the baby. You can talk to your baby. You can ask your partner also to get involved. Now coming to the changes in the mother. The mother actually experiences a lot of changes during this part of the pregnancy, though she's quite comfortable then compared to the previous months. The mother can experience a backache or a low aching pain because the uterus is now growing, and the pressure that it puts forth on the muscles and ligaments can cause a certain amount of backache. Using a chair with good back support or lying to your side with pillows in between your legs will help. Now coming to the breast changes, the breasts are now growing because you're preparing to feed the baby after delivery. So you can find that the breasts have become larger in size. There can be skin changes over the breast, darkening of the nipples. So you can go up a bra size or even use some extensions if it's going to be comfortable to you. Certain patients also experience thin white milky fluid per vagina, which is normal. It's called as leukorrhea of pregnancy. So unless the discharge starts smelling bad or turns color to green or yellow, you'll not have to be worried about it, because if it changes in color or is foul smelling, there's a chance that there's an infection. So using panty liners in normal cases will help. Coming to quickening, this is something which all the mothers are excited about. So mothers who are pregnant for the first time will start feeling the movements of the baby around 20th week, which is about 5 months of pregnancy. If you've already delivered a child and this is your second or third pregnancy, you can feel it a little earlier. So it'll be felt as small, delicate flutters in your lower abdomen. Coming to weight gain. So now that the nausea and vomiting of the first 3 months has relatively subsided, you'll have a craving to eat a lot of food. So weight gain at this point has still, it has to be checked on, because the recommended weight gain during this period in a normal pregnancy is around 4 to 5 kgs in these entire 3 months. So you'll have to be aware of what you're eating and everything. And also only 300 to 350 kilocalories is all that you need during this part of your pregnancy. So anything more than that, you're going to have too much of weight gain. So these are all the general changes that can happen. There can also be mild swelling of your feet and ankles. There's really nothing to worry about in that case. Coming to what you can expect in a doctor's visit. Certain investigations are done during your visit to a doctor. You might have to go for monthly checkups at this point of time, and maybe a little earlier than monthly checkups in case of complicated pregnancies. So the doctor might want to check your weight during every visit, will want to check your BP if it's normal during every visit. Will also sometimes will also see your abdomen and see how the uterus is growing. Certain investigations are done specific to this period of pregnancy. One is the GCT, which is the glucose challenge test. It's a screening test to diagnose, to screen for diabetes. And a majority of the Indian population are diabetics. So especially now, you can see that a lot of pregnant patients develop gestational diabetes mellitus. So they're usually, you don't have to go for fasting in case of GCT, if you're planning to take a GCT. So a shot of glucose is given and then 1 hour value is taken. And if that value is above normal, then the doctor would recommend you to do a test called as GTT, which is glucose, oral glucose tolerance test. So this has to be taken in a fasting state, and then glucose is given, and then 2 more values are taken, blood values are taken. So from then, the doctor will be able to know whether you need just a dietary management, or if you need any drugs, tablets for your diabetes, or even insulin for that matter. So, and then the other thing is vaccinations during this time. The most important vaccines are tetanus. If the mother's vaccination status is unknown, we usually give 2 doses of TT 1 month apart. And these days we give something called as Tdap, which has a combination of, which is for fighting against diphtheria, pertussis, as well as tetanus. But this is usually given a little later into the pregnancy for maximal response. So sometimes we also give 1 dose of TT and then the second dose as. Now coming to the medicines to be taken, the definite medicines to be taken are iron and calcium. You'll be able to tolerate iron more during this pregnancy, because the first 3 months you'll already, you would have had a lot of nausea and vomiting. So you will relatively be able to tolerate iron during this period of time. But again, a lot of patients still do have a certain amount of constipation, loose stools, and you might also have black colored stools, which is also normal when you take iron. The next drug is calcium. Calcium, 1 tablet has to be taken every day. And you should bear in mind that both iron and calcium should not be taken together. So it has to be taken at 2 different parts of the day. If you're taking iron in the morning, you can take calcium in the night, or vice versa, however it is. And if you're already on some drug, like for thyroid disorder or even for sugars, you'll have to talk to your doctor. Do not discontinue the medications by yourself, because certain medications have to be continued through the pregnancy for optimal health of you as well as the newborn. And I forgot to mention another vaccine, which is the flu vaccine. That can be taken at any part of any time during pregnancy. It's just 1 dose that can be taken. Now coming to genetic testing. The genetic testing is a specialized form of a test that is done during pregnancy. If, for example, your NT scan was abnormal, NT scan is the scan that was done at around 12 weeks of your pregnancy. If the doctor feels that the NT measurement is abnormal, he or she might want you to go and do an advanced testing also. So you might be asked to do a non-invasive NIPT, which is non-invasive prenatal testing, or sometimes even if that is positive, you might be asked to do something called as the amniocentesis. Amniocentesis is taking the fluid around the baby and getting it tested. So this gives a more definitive diagnosis if the baby is abnormal. So these genetic tests are done to see if the baby has any abnormalities, any congenital abnormalities, also genetic abnormalities. So if everything turns out positive, you might be referred to a geneticist, and further counseling regarding continuation or termination can be done accordingly. Now coming to the do's and don'ts of pregnancy, the diet is a very important thing. And as I said, you just need an extra of 300 to 360 kilocalories at this point of time, nothing more than that. So if you can split your meals as 6 meals rather than 3 heavy meals, it would really help in optimizing your blood sugars as well. Intake of plenty of fruits and vegetables is very important. Try to reduce the amount of carbs, maybe a little bit of rice with 3 to 4 types of vegetables for lunch, having an egg if you're vegetarian in the morning along with your breakfast. Adding a good amount of protein always helps. And plenty of water again is very important, because there is a chance that you might get dehydrated really fast. And eating meals like this, that is when you divide into 6 meals and half, there's a lesser chance that you have gastritis also, as you're taking iron at this point. And intake of iron, calcium rich food like meat, tofu, fishes that have bones in them, paneer, all this helps. And also you might have experienced a certain amount of constipation, in which case you can have plenty of fiber rich food as well as adequately hydrate yourself with water. Now coming to exercises, if you're a person who's already been working out, you've been already walking and all, you can continue doing all your exercises if the pregnancy is uncomplicated. Or if ever you feel that if you've never done any exercise before, in that case you can start off with walking. You can start off with 5 to 10 minutes per day and gradually increase it to 30 to 40 minutes per day. You can do some flexibility and stretching exercises. There are some exercises that helps in strengthening of your pelvic floor muscles, and these are called as Kegels exercises. So once your pelvic floor muscles are strengthened enough, it will be easy during delivery. Coming to travel, this will be a great time to plan your baby moon. You can have a relaxed getaway with your husband or your family and friends, because as you progress through your pregnancy, there might be you might physically find it difficult to plan a trip. And also certain flights have limitations regarding travel during the 3rd trimester of pregnancy. So if you're planning to go, this would be a great time to plan any trip. But again, ask your doctor if it's okay to travel, and if it's an uncomplicated pregnancy, you should be able to travel. Now, how do I sleep is something a lot of people ask, because you should know that sleeping upright for a prolonged period of time can put a lot of pressure on the veins below your uterus, because now that the uterus is growing, it has come out of the pelvis, it is somewhere up to your umbilicus and growing beyond. So compression of those veins behind your uterus can impair the circulation. So it's okay if you lie for a couple of minutes straight, but it's always advisable to lie on either side, preferably the left side. And you can keep a pillow between your legs. There are maternity pillows, however you're comfortable. And now coming to intercourse, is intercourse safe? Yes, relatively intercourse is safe during this period of pregnancy. But again, if you have conditions like placenta previa, where the placenta is lower down, you will have to consult your doctor and abstain from intercourse. Now you can wear comfortable loose clothing because now that your baby bump is showing. These are the do's and don'ts. And now coming to the don'ts of pregnancy, sorry. So doing any strenuous exercise or lifting extremely heavy weights is not recommended. But and also smoking, alcohol consumption, or usage of illicit drugs is not recommended at any point of pregnancy. And try to avoid too much of caffeine, and also raw fish or fishes that are high in mercury. So if you're planning to join antenatal classes, this is a good time to start your antenatal classes, because you will be meeting a lot of expecting mothers just like you who are going through the same journey. So talking to them might provide you a lot of relief in certain aspects. And also you can gain more knowledge about pregnancy. And this will also not help you to bond with the baby, but your partner can also come along with you during the antenatal classes and bond with you and the baby as well. And registering the hospital that you're planning to deliver in is important. So even if you're traveling to another place to deliver, it's better to have a couple of visits during this time with the doctor that you're going to deliver, because the doctor will have your history and will be able to follow it more effectively when you go back for delivery. Now, coming to complications, there are certain complications that high-risk patients who probably have diabetes or hypertension need to be vigorously monitored. You might be asked to come in for frequent checkups than a normal pregnancy, and extra blood investigations and urine tests could be done during this time. So if ever your cervix is small, the doctor might even advise you to undergo something called as a cervical encerclage, which is tying a knot around your cervix. So in that case, you will be advised to have bed rest and not strain too much. Some patients can have a low-lying placenta, which can cause bleeding during this period. Though a lot of times the placenta migrates, you'll be seeing that the placenta gradually goes up in the scans as the uterus becomes bigger. Now, if you anytime experience symptoms like weight loss or yellowish discoloration of your eyes or excessive weight gain, bleeding, fever or severe abdominal pain, you have to report to your doctor and see what's going on in your body. These are some red flag signs during this time of pregnancy. So this is all that I have to say today, and just bear in mind that the second trimester is a wonderful time for you to enjoy your pregnancy, for you to start recording your pregnancy progress, for you to start taking photos and recording all that. Because as I said, you're relatively more comfortable than you were during the first 3 months, and that you would be in the next 3 months. So have a very healthy, happy pregnancy. Thank you.
Very informative session, lovely talk. I guess we have a lot of questions this time, so let's jump onto it straight away. Hi, Dr. Suganya. I just noticed my gums have started bleeding suddenly. Is this normal?
Okay. So it is seen that a lot of people have bleeding gums during pregnancy. It's mainly because of the hormonal changes. This should go away once you deliver. But taking care of your oral cavity is very important. Brushing twice daily, flossing your teeth is very important, because there are some studies that have linked gum disease, poor oral hygiene, to even preterm labors. So if you experience any foul smelling odor or continuous gum bleeding, in which case you'll have to visit your dentist.
Yeah. And the next question is, doctor, my sister is 22 weeks pregnant. She says she can feel the baby moving. When can I feel it too? So she's pregnant too, but she's saying that her sister's 22 weeks and she can feel it moving, eager to feel the baby move.
Now that the baby is growing bigger and stronger, the patient usually starts experiencing it around 20 weeks. Certain patients experience it a little later. But as I said, if it's your first pregnancy, you should be feeling it around 5 to 6 months. And if you become pregnant before, it will be a little earlier than that. And generally, people from outside can start perceiving it around 22 to 24 weeks also.
Yeah. The next question is, ma'am, is there a way to control my gestational diabetes through diet? Worried about how it will affect my baby.
Gestational diabetes is, as I said, very common these days. And see, you'll have to do these investigations. You can do a glucose tolerance. I mean, if you're an established diabetic and your doctor has put you on a dietary management, then that should be sufficient. But you will have to still follow up with your blood sugars. Regular monitoring of blood sugars need to be done if it's under control. If despite taking a diet, if it's still not controlled, the doctor might put you on medicines and insulin, which is mandatory to take, because there's a chance that if you do not take, your sugars can become uncontrolled and have an effect on your baby. Your baby might become big and there can be issues in the baby.
Yeah, we're seeing it very often nowadays. I think the second trimester is the time when you're getting comfortable with your pregnancy, your appetite is coming back, you're eating well, your friends are sending you pastries and cakes and everything. And that's when you start eating a lot. So just be careful about, what you take. I think portion control is very important during the second trimester. Eat whatever you want, but just your portion control is important. That way you might be able to prevent gestational diabetes. But if there is a little bit of a genetic tendency or something, then maybe you can't escape it. But there's a lot of meal plans, a lot of diets out there that are available that you can control your diabetes with a diet itself. But if your doctor puts you on insulin, I mean, there's nothing wrong with it at all. In fact, don't worry about taking insulin. It's good for your pregnancy and for your baby. The next question is, any way I can find out the sex of my baby? I really want a girl baby.
Well, this is something that a lot of people ask. The thing is, it's true that the reproductive organs get formed and you'll be able to see it in the ultrasound, but you should know that it's illegal to determine sex in India. So as much as you want a girl or a boy baby, we can't do anything until the baby is born.
Yeah, I think, well, what you should really look forward to is having a healthy baby rather than, thinking, I know it's exciting to do, whether it's a girl or a boy, but yeah, not allowed in India. Hello, doctor. Is it true that even if I don't have symptoms of urinary infection, I can still have it?
Yes, absolutely. There are about 20 to probably 30% of people in pregnant ladies who do not have any symptoms of urinary tract infection like a burning urination or fever or pain just in your suprapubic region, but they still can have bacteria in the urine. So this is called as asymptomatic bacteriuria. And this has to be treated because if it's not treated, the infection can ascend up and affect your urethra, the bladder, and even your kidneys, which is a high risk condition. So it is mandatory to treat asymptomatic bacteriuria.
Yeah. Hello, doctor. What do I do to avoid stretch marks?
Stretch marks. You can't really completely avoid stretch marks. And also, if you get stretch marks, it may not completely go away as well. But what you can do is you can opt for a healthy weight gain during pregnancy rather than a rapid weight gain, because stretch marks is caused due to over distension of the abdomen. And using moisturizers and oils are shown to probably control it a little bit. But again, if you're prone to getting stretch marks, there's really nothing you can do 100% about it.
Yeah, there's no escaping stretch marks, but like you said, it's a very good point that if you control the amount of weight that you gain during pregnancy, there's a wide range. Like somebody who's within the normal BMI, you can gain anywhere between 10 to even 15 to 16 kilos, but you don't have to gain 15 to 16 kilos. So if you keep your weight under check, there is a possibility that the amount of stretch marks that you get are a little less. Good evening, ma'am. My friend is worried about hair loss during pregnancy. What are the effects of pregnancy on hair loss?
Usually a lot of people they're happy with the luxuriousness and the thickness of the hair. It's more lustrous during pregnancy. But yeah, there are a certain amount of population that do experience hair loss. There can be changes in the hair texture as well. And you should not be worried a lot about this, because whatever hair you're losing is you're going to get it back after some time. And you can shed now, but once you start feeding the baby, probably 6 months to 10 months into feeding, it should be back to normal. But again, there are some conditions if that can cause excessive hair loss. So if you have too much of hair loss, you can check your thyroid values, your hormone values. I'm sure these all would have been done in the first part of the pregnancy, but if you're worried, you can meet your doctor and probably do these tests and see.
Yeah. The next question is, nowadays, most of the hospitals are suggesting a growth and Doppler scan around the time of pregnancy. Around the time of anomaly scan, is it mandatory? Sorry, the question is, nowadays, most of the hospitals are suggesting a growth and Doppler scan around the time of the anomaly scan. Is it mandatory?
No, usually growth and Doppler is done in the third trimester of pregnancy, because at anomaly, we'll just like to know if the baby is normal, if the external parts of the baby is normal, and if the fingers and toes, the internal organs like heart are relatively normal. If you're a high-risk patient with the history of cardiac disease, or you had a previous baby with cardiac disease, and the doctor might ask you to do fetal echo, 24 weeks, but growth scan is not mandated. It is not usually done at 20 weeks, usually the third trimester of pregnancy.
Yeah, yeah. Growth in Doppler scans is something that's done later on. I don't, maybe your doctor, maybe you've got it wrong. Usually during the anomaly scan, basically all the parts of the baby are checked for if things are fine. A Doppler can be done at any point, and even at the anomaly scan, if a Doppler is done, it's all right. I don't think there's anything wrong with it. It's always good to do a Doppler at any point. If you're doing a scan, and if you don't mind paying a little more for the Doppler part of it, I think it's always good to do it because it gives you a lot of information about the health of the baby. Any vaccines to be taken in the second trimester?
I touched upon this. Definitely, tetanus is something that you should not miss. And these days, Tdap is given towards after around 28 weeks to maximize the response to the baby. But flu vaccine is optional, but it's still advisable to take one shot of flu vaccine during your pregnancy.
Yeah, yeah. Vaccines are very important during pregnancy. They can prevent a lot of diseases, and hence it's very, very important. I think Dr. Suganya has already touched upon that. And the next question is, doctor, I have a low-lying placenta, and my doctor says that in some time it will get better. Will it get better? Or I've been reading the internet, and I'm worried a lot. Can you throw some light on this?
Yeah, sure. Yeah, the thing is, please do not Google your symptoms. Please do not Google what your doctor is telling. It causes a lot of unnecessary mental trauma. But your doctor is right in the sense a lot of the placentas that we see that are low-lying usually migrate as the uterus grows. So you might see a low-lying placenta in your anomaly scan, which may not be there when you do a 28 weeks or a 32-week scan. Unless it is persistently low-lying, there's really nothing to be worried about. It can only be known in the scans, in the progressive scans.
Yeah, yeah. And after doing my scan, my doctor has asked for a NIPT. What could be the reason that the doctor has asked for this NIPT? And this seems to be a very expensive test. Is it really necessary?
NIPT is non-invasive prenatal testing. We usually don't do it for all the patients. If the doctor has done an NT scan or if the doctor felt that there was something wrong with the NT scan, there's a chance that he might have suggested the NIPT. It is definitely an expensive test, but it throws a better light on how to take your pregnancy from then on to rule out any anomalies that can be seen at that point of time.
Yeah, NIPT back in the day, probably the doctor has seen something on the scan, which is, that's why they've asked for this particular NIPT test. Maybe they want to rule out some chromosomal defects or some sort of an anomaly in the baby. Back in the day, your only option was to go and do something called an amniocentesis. So you're doing something called doing an invasive test. You'll have to pass a needle through your stomach and then directly into the sac where the baby is there and take out some fluid. And while doing this, it can be dangerous at times. People have lost their pregnancy even while doing this. So NIPT has come in as a boon, as a blessing for many people now. And it's got great accuracy to rule out many of the syndromes. So just with a small blood test, you're able to, it has an accuracy almost of 95-96% for certain syndromes, mainly for Down syndrome. So maybe that's why they've suggested it. But most of the time, this is only done to reassure you, okay? There are only markers that they pick up on scan. So many of the times, most of the time, the test is going to be negative and you're going to have a beautiful, healthy pregnancy. Don't worry. So I think we're going to wind up. Okay, there's one more question. How can I avoid stretch marks? I think we touched upon this already. Basically, stay within, don't gain too much of weight. Stay within the, prescribed weight gain. And you can apply some moisturizer or any of the oils available at home. That way you can reduce the amount of stretch marks, but there's no chance of really escaping it. So I think we'll wind up a session for today. Thank you, Dr. Suganya. That was a lovely Q&A session that we had. And we're going to be coming next Saturday, again at 4 p.m. with our pregnancy web series. So please tune in next Saturday. Thank you. Thank you, everybody.